of maternal and child health, as well as equity, are central to the review of the National Health Insurance Scheme. I wish, therefore, to draw the attention of this review meeting to also focus attention on putting maternal and child health as well as equity at the center of a reformed National Health Insurance Scheme, as we endeavor to find solutions to the implementation challenges facing the program. Let us not forget that in doing this, we are also addressing the Sustainable Development Goals on poverty and health. I wish to end my statement by calling on all to ensure that the deliberations are held in a cordial atmosphere, to ensure that we put the health needs as well as the welfare of the people of Ghana first. I thank you all for your attention, and I wish us all a fruitful deliberation. Thank you.
Thank you very much.
Your Excellency, the Vice President, colleague Chairman, colleague Ministers of State and Members of Parliament, our partners in the healthcare sector, in particular the development, members of the NHIS Review Committee, as well as board members and chief executives, of the fund, invited guests, ladies and gentlemen from the media and elsewhere. It's undeniable that the health of population of any country has a significant correlation to the economic development of that country. This is the reason why health featured prominently in the Millennium Development Goals. At least it occupied 3 out of the 8 goals, with a direct focus on improving health of the population. The 2015 report on Ghana shows that significant progress was made in the areas of health, particularly in infant and child mortality rates, where a reduction from a 57 deaths per 1,000 live births in 1993 declined to just 19 per 1,000, live births in 2014. Meeting ahead of the schedule, the MDG target of reducing child mortality by 2/3 by 2015. A major reason for the good performance in this area, just as we have with the GET Fund in education, is the National Health Insurance Scheme. I must also mention, when it comes to rural development, that the District Assembly's Common Fund becomes very important, and I'll return to this theme, Your Excellency, Mr. Chairman. However, there remains, to improve in getting a healthy population. We need to do this. With the end of the MDGs, its successor, the SDGs, placed similar importance on healthcare. Goal number 3 stipulates that countries shall ensure healthy lives and promote the well-being for all at all ages. Moreover, the finance for development element also puts a lot of focus on domestic resource mobilization in the context of the SDG goals. We know, therefore, that for as long as we increase, domestic resources, in particular the value-added tax, which is the base, for the GET Fund as well as the health insurance, it means that there's a direct correlation to the issue of the government-sponsored health insurance since 2003. Although financing the scheme has had its challenges, there has been good progress, as I just cited, particularly with respect to the MDG goals. As we transition into lower middle income country, our access to concessional financing and grants will dwindle over time. And this, again, is another reason why we must put significant efforts on domestic resource mobilization if we are to make progress in development, both in infrastructure, such as the building of hospitals and CHIPS compound, and also in providing recurrent health care, whether through insurance or drugs. There has to be an active participation from the private sector in the development of healthcare infrastructure. This means investors will have to be certain of good returns, private sector being what it is, on their investments. So with an effective and efficient health insurance scheme that pays service providers on time, this should provide an incentive to investors. The banks as investors should also play a more active role in financing of healthcare infrastructure, in the country. Your Excellency, Mr. Chairman, this is the context in which we in the Ministry of Finance welcomed the review that has just been, been underway, and we had the opportunity to share our own thoughts, with the committee. Our lower middle income status has also seen the exit of, will see the exit of NGOs who provide, some of the support in the healthcare. But I think that in as much as these are bound to happen, they are not going to go away completely, but we should recalibrate and make sure that our domestic resources are sufficient to meet our healthcare requirements. Over 30 million visits were made to various NHIS accredited facilities, which is hospitals, clinics, health centers, pharmacies, etc., on account of the scheme. The scheme has certainly improved access to healthcare by reducing the financial barriers that existed before its implementation, some years back. NHIS has been the system of healthcare financing in Ghana for over 10 years. The NHIS, just as a reminder, and I believe this has been covered, are derived from 2.5% of the health insurance levy, which I mentioned earlier, 2.5% of each person's contribution to the basic national social security, and insurance trust scheme, and monies that accrue to the fund from investments made by the authority, contributions made by members of the scheme, that is premium, that may be paid, as well as monies that are approved for the fund by Parliament. I must say that one area in which we have seen a bit of retrogression is the building of a real fund, because the essence of the statutory funds are to build funds that in many instances generate income, and therefore most of recurrent expenditure are covered by the returns, from the fund. Similarly, the fund provides the basis, for borrowing for infrastructure. In this case, infrastructure to support, health insurance. I think this is a feature which our statutory funds must refer to, and in particular, when we look at the formula that goes to Cabinet and Parliament, for approval. Another area is in the alignment of the statutory funds to national objectives. And here again, I think a lot has been said already, particularly by my, colleague minister, the extent to which, health insurance, is serving a social intervention need. The Ministry of Finance, with approval of Cabinet, presented to, Parliament in the policy, review, the need for us to make our statutory funds the focus of social intervention programs in Ghana. I think for a long time, when we talk about social intervention, the focus has been on utilities and petroleum. But in fact, if you look at the balance that is required as you become a middle income or a richer economy, it is the balance in terms of, what is called balanced development or growth lies with the vulnerable. And it is the view of governments, that looking at our statutory funds and the amount of resources that are devoted to these funds, we can make them, turn them into the basis for social intervention in the country. This is Assembly's common fund, for urban and rural development, as every district assembly or metropolitan and health assembly benefits. GET fund, as we know, in flagship projects like schools and trees, which permeate, the rural areas, textbooks, scholarships. It should be the two. And then also we do have health insurance. Of course, there is the, road fund, which can be dedicated to rural development. It is in this context that, the statutory funds, needs and continues to be redefined as a basis for social intervention, for inclusive growth within context of our GSGDA. In conclusion, Mr. Chairman, Your Excellency, for Ghana to have value for its money in investing in the health sector, we need suitability and accountability in the health sector. The wider and more equitable coverage of health service, as I just indicated, can be achieved through a more effective and efficient application of resources. And this is my understanding of the gathering here. I thank you very much.
Who, fortunately, is the Vice President of the Republic. So with a standing ovation, shall we receive the Vice? Shall we receive the Vice President, His Excellency Pakwesi Amissah-Arthur?
Mr. Chairman, Ministers of State, members of the review team, and colleagues, great privilege for me that you have asked me to formally welcome members of this review team. And everybody has said that in September last year, the government constituted a committee to review the current status of the national health insurance system and make proposals for its reform, taking account especially of the significant financial challenges that faced the scheme. Health financing is really a global issue. If you go to the United States, they are discussing health insurance, Obamacare. And I hope that after they've dealt with the radical Muslim and other issues around the campaign will focus on health, because that's an important thing. In the UK, it's an issue. In France, it's an issue. Everywhere, it is an important issue. The access, the coverage, equity in health financing is a major issue for every country. And so I hope that it also will become an issue here in this room so that it doesn't become a partisan issue in the campaign that we are going to embark on. That is why I must admit I hesitated when the Minister of Health asked me to come and speak at this forum, my initial invitation, because I know that any wrong word that I say will preempt the major issues that the technical committee has identified and create its own furor. But I was sure that broad consultation has taken place, and it will be difficult for even one careless word or two careless words to derail the whole process of review of the National Health Insurance Scheme. That's why I agreed to participate, and I have not been disappointed listening to the various speakers, the earlier speakers, because I think the consultation has been extensive and the issues have been joined, stakeholders are here, and the general public is also interested. So I'm speaking really not to you people in this room, but to the audience outside this room who may not understand the issues in the detailed way in which you understand it. So let me welcome myself also to this review and say that it is part of a larger consultation as we seek to elicit a broad range of views on how to strengthen the NHIS and increase its coverage especially through innovative financing. And I say this because the Finance Minister didn't say it, but the government's budget is seriously constrained. And therefore, the easy option of saying that, oh, allocate some more money to the NHIS is no longer available to us. Therefore, we must innovate. We seriously need to think about other ways of providing financing so that we can increase the coverage of the National Health Insurance Scheme. Mr. Minister, even as we face these financing constraints, we should not abandon the pursuit of good health for our people, for our citizens, because it's necessary for sustaining the development of the nation. The Minister has spoken about Sustainable Development Goals, and we as a nation have committed ourselves to it, and our President is even one of the two heads of government involved in ensuring that we deliver on the Sustainable Development Goals. Because health insurance is an efficient way of extending access to health services. And in Ghana, the National Health Insurance Scheme is an integral part of our social protection strategy, which is intended to guarantee access to basic healthcare services without having to pay out of pocket at the point of service delivery. I think that many people understand this out of pocket as cash and carry. So we do not want to focus on the out-of-pocket delivery or the cash and carry. So the government is committed to providing healthcare based on an efficient NHIS with the aim of progressing to universal health coverage. An integral part of this strategy is the community-based health planning and services, popularly known as the CHIPS, which is a key driver of primary health care. That's to provide primary health care to the underserved, especially those who live in remote rural communities. Mr. Chairman, I'm told that the NHIS benefits package is estimated to cover about 95% of disease conditions reported in our country. But the cost of providing health care to NHIS members is increasing much faster than the financial resources available to the scheme. The increasing cost of health care have contributed to the inability of the NHIS to settle claims to healthcare providers in a timely fashion, and that's part of the problem. So the implementation of a sustainable health insurance scheme is challenging. Resources are inadequate, the needs are growing, the capacity is not there. That is the reason why it should provoke and stimulate us to introduce features that improve the sustainability of the health insurance scheme. So we have to look at the insurance design, at the financing mechanisms, at population coverage, at the benefits package, the cost containment especially, as well as the compensation for health providers. Mr. Chairman, we live in a very dynamic world with changing disease and disease burden. Economic structures are changing very fast in the world. Production and work patterns are changing, have changed, and with it, our lifestyles. As we live further away from our workplaces and our children live with us and they have to come to school, we are waking them up earlier, they're eating before they are awake, they close from school late because the parents have to drive them, and they eat late and sleep late. And this is all affecting our health. The type of meals that we eat, fast food, lots of protein, no carbohydrates, and the timing and regularity of eating, as I say, are all changing. It's a nutrition transition. It's contributing to lifestyles that are escalating diseases. cancers, hypertension, diabetes, obesity, regularly now, more than a decade ago. The sedentary lifestyle that we have adopted, TVs with remote control, you don't have to get up to change the channel. You sit and change it. Mobile phones, you don't have to get to a phone. The phone is at your back, at your side. Computers, games that children play, they don't go out and play soccer, gutter to gutter. They play in their bedrooms. They don't have to move. And all these are implicated in the obesity and the chronic disease and epidemics that are facing us. And additionally, technological products have become sources of environmental pollution. I saw a BBC program of people excavating computers for metals. And so poor communities are at risk in our cities from these. So the lifestyle impact on health is also something that is important and we must focus on. How to fund healthcare with costs that are increasing needlessly. So it is in our interest to develop healthy population that will directly contribute to improving productivity and enhancing life expectancy. Mr. Chairman, as stakeholders in this enterprise, we all have a need for a sustainable national health insurance scheme. That's why I hope that the work of the Technical Review Committee will provide the basis for sustainable, equitable, and accountable health insurance scheme that develops in our country. It is on this note that I formally declare the review open. I thank you, all of you, for coming. I believe that this forum will provide valuable insights to improve the quality of the report and validate their findings so that we can together make progress. I hope that the interaction will be serious. I know that there are many serious people here and that we shall all benefit from this interaction. I thank you very much.
All right, thank you very much, Your Excellency, the Vice President of the Republic.
Thank you very much. I believe that I will just say all protocols observed instead of going through all the names again. Can I give a very short summary? We've all heard what has been said. Before I begin, can I just inform those present of those who have come up with this report which you're going to review? We had a technical committee, and the members were as follows. We had Dr. Chris Atim, we had Nathaniel Otu, we had Huiwei Wang, Professor Irene Ajipong, Peter Yeboah, I'll let them all stand up at the end of Dr. Obeng Apori and Dr. Victor Bampo. Will you all stand and be acknowledged by the... Now, apart from the technical committee, we had an advisory committee to help them with their work. And it involved local experts such as Professor Bedu Akosa. We had Mr. Nwama Donko. We had Professor Frimpong Boateng, Mr. Charles Abukri, Dr. Eli Atipui, Mr. Joseph Domi Kugnuru, Honorable Nana Oyelita, Dr. Awudu Tinoga, Dr. Frank Nyanato, and we had some legislators involved, Honorable Richard Anani, Honorable Yile Tre, Honorable Mohammed Mutaka, and Honorable Matthew Poku Napoleon Prempre. We also had from academia, Professor Adenu, and from civil society, Dr. Steve Mauto, Mantio, Mr. Kofi Asamoah, and Cecilia Sanu. I haven't gone into all their titles. All those I've mentioned who are present, would you please stand and be acknowledged, please? And if I have pronounced your name wrong, please, please forgive me. I happen to suffer from that as well. I've been called many things in my life. In terms of what you've heard, we've had brilliant speeches. The focus, actually, if I have to summarize, was put together well by the VIP when he says this is about sustainability, it's about equitable distribution, and it's about accountability. Everybody's speech, more or less, has embodied that, with the special emphasis, obviously, on maternal and child health. I will not go into the detail of what our dear doctor said with regard to that, because I think everybody here has got the full strength of it. Can I say that the reason I went through all the lists and called all the names is I wanted to reiterate, at least in this room, that it was put together because people were more concerned about it being for Ghana rather than for any political party or any particular group. So you will notice that it covered the whole spectrum of political parties, of civil society, of experts in their various fields in terms of the reports that has been put together. As minister and on behalf of the presidency, I want to extend my full gratitude, because there's no vote of thanks after this, to all and sundry who have attended, and would like to thank the Vice President especially for honoring the occasion and giving the remarks he did. It gives the importance of it, and the beauty of this is you have Ministry of Finance here as well. The Minister himself has attended. You have Ministry of Social Agenda, you have the Minister of Health, you have heads of departments, agencies, and all of you who have come together to make this thing a reality. The National Health Insurance, what you've heard the statistics, but what it doesn't say, because we're looking at solving issues, is the extreme help it has given to our people. It has been a very, very useful intervention. And all the people who have benefited of it, the millions who have benefited from it, are not spoken about necessarily in a forum like this, because this forum is geared to try and solve issues. So let's try and make this work. Let's take the recommendations that have come, and whatever recommendations that are approved subsequently when it gets to the level of the presidency and possibly at the cabinet level when it is all accepted, I as minister will ensure that whatever recommendations are given, we will definitely implement over the time space that we are given. And we will also look at the provision of the council that was mentioned by the chairman, which will then assist the NHIA to be able to perform its functions.